Hi, my friend. My name is Dr. Sayyeda Amna Memo. So today I am selecting the topic of fetal echogenic bowel related to ultrasound findings. So first we have to know the definition. What is the definition of echogenic bowel? So it is defined as the one or more area of bowel that are bright. Bright mean as same as the bone echogenicity which we are seeing in ultrasound, and then we see to note it the low the gain in the ultrasound and then compare to the bowel. So you see this is the echogenic bowel, it is more bright to the bone. So and the echogenic bowel can be detected by prenatal ultrasound at around the 20 weeks. At the time of anatomical or morphological ultrasound, typically the bowel it will be the small gray in color as compared to the liver, because it is not bright, but sometimes the bowel appears in white bone in color, which is called as the echogenic bowel, as it is showing in this picture. So what is the risk factor? Then we have to be find this echogenic bowel. We have two echogenic bowel fetus to exclude the aneuploidy, fetal cystic fibrosis, intestinal bowel obstruction, and some infection like cytomegalovirus. The presence of echogenic bowel on ultrasound is dependently associated with increased risk factors of the both as clinically IUGR and the possibility of the intrauterine fetal dismiss. Now, what is the incidence in all over the pregnancies? Incidence is only is 0.2 to 1.4 in pregnancies. The clinical significance is isolated finding of the echogenic bowel, so it is possibility you have to check the infections. So just keep an eye of that mother, especially for the growth, because there is a chance of the fetal dismiss. Other factors must be include like the cystic fibrosis, aneuploid, and the infections in second trimester. The causes. The cause is the most frequent cause of the fetal echogenic bowels are the related to the kidney and the chromosomal abnormalities. Sometimes we have to be see the internal hemorrhage of the abdomen in when we are doing in the ultrasound. So subchorionic hematoma, and sometimes it's a small separation of the placenta. So we have to see the placenta separation. So when the most findings is visualized in ultrasound is around the 18 weeks. This subchorionic hematoma or placental separation is related to the echogenic bowel. In ultrasound, we have to see the stomach of the baby, because if we have the hemorrhage, internal hemorrhage, and then the baby is inhale the blood particles and the stomach is full. So it's having the echogenic bright stomach also having some particles. Now this pictures is showing some studies around 108 fetus. How much the echogenic bowel we have to receive on 70%. We have to receive the intestinal loop dilatation around the 13%, and few have the gallbladder problems. The number of babies are 108 is only few have the mixed feature also. So what we are offer in the echogenic bowel if we have received the baby, so we have to carefully ultrasound examination. Then we have offered the amino because baby we are receiving mostly 18 plus to finding of this echogenic bowel. So we are offered the chromosomal whole and see in the immunosynthesis to pick up the fluid, and then cell free fetal DNA we also offer to the maternal, and to see the maternal test of the blood stream we also do exclude any NIPT to Down syndrome and genetic testing to exclude by the NIPT or either by immunosynthesis. The mother we have to be careful to the past history. So we have to know the any cytomegalovirus history of previously or recent, or any infections will be happen. If the results show any positive infection, so you have to be confirm this is the infection is causing the echogenic bowel. Maternal blood test for the cystic fibrosis, so you have to check the genetic testing, or you just know the past history, either the mother or either in the family, or this is the cystic fibrosis have the very normal finding. The clinical requirement is that If it is isolated finding, so you have just keep an eye for the baby growth, and we just to exclude the intestinal bowel obstruction. If it is not obstruction, just the growth is important, and then after the baby is delivered, we have to be check the intestine is not, is just is fine, and then required in the uterine serial growth assessment, because there is a chance of the fetal dismiss. Thank you so much. This is our topic of intestinal bowel obstruction. Thank you.